Parasites of the Pacific Northwest, presented by Christina Cranley. So a little introduction. I specifically interviewed Dr. Joe Roberts, which is a doctor of veterinary medicine at the Kalapuya Veterinary Center. They treat small animal and equine, and they specifically use wellness techniques, radiology, in-house blood analysis / medical treatment, emergency care, and much more. Kalapuya Veterinary Center is located in Sutherland, Oregon, which is in Douglas County and contains the Umpqua River. So if we look at this map here, this is a map of Oregon, and this red star is Sutherland, which is inside of Douglas County, and we have the Umpqua River running here. So the common parasites in this area are Toxocara canis, which is the roundworm. It mostly impacts dogs, but it can also impact cats. And then Giardia lamblia, which impacts dogs and humans. And then Nanophytis salmonella, which mostly causes problems in dogs. So throughout this presentation, I'm going to focus on Nanophytis salmonella, which causes salmon poisoning disease, but it doesn't actually cause salmon poisoning disease because it is just the vector parasite. What actually causes salmon poisoning disease is the bacteria Neorickettsia helminthoica, which is a rickettsia-like organism, but it is an obligate intracellular parasite, so it needs the vector to survive and reproduce and to even cause problems. So a little bit about the life cycle of Nanophytis salmonella. The first intermediate host is the stream snail. The second intermediate hosts are the salmonoid fish, as well as some other non-salmonoid fishes and the Pacific giant salamander. The definitive hosts are fish-eating birds and mammals, as well as raccoons and skunk. So the definitive hosts are a lot of mammals, but most of the problems are caused in dogs. And so the infectious stage is the metacercaria. So if we look at this life cycle diagram here, you can see that the eggs are passed in the feces, and once they reach water, the eggs develop into Mericidium, which then infect the first intermediate host, the snail, and the Mericidium develop into Cercaria. And once they've developed into Cercaria, they leave the snail and swim to penetrate the fish. So the Cercaria then develop into Metacercaria, which become encysted in salmonoid fish as well as other fishes. And then the definitive host will then eat this fish or the encysted Metacercaria, and the Metacercaria will then develop into an adult fluke within the intestinal tract. And when it feeds on the lining of the intestinal tract, it actually injects the bacteria, and the bacteria at that point is what causes salmon poisoning disease. So salmon poisoning disease, like I said previously, it can infect the Nanophytis salmonella can infect a lot of different hosts, but salmon poisoning disease actually only occurs in dogs, coyotes, and other canids exclusively. But dogs are extremely susceptible with a 90% mortality rate. This disease in dogs is pretty rapid and can be severe, where death can actually result in 10 to 14 days. But the key point here is that there is a good survival rate if the dog is treated quickly. So these are some of the major symptoms. Fever, which is often greater than 104 degrees Fahrenheit, facial swelling, depression, loss of appetite, thirst, vomiting, diarrhea, nasal or eye discharge, and weight loss. So diagnosis and treatment. So the first diagnosis is really just, if you notice any of these symptoms, you really need to bring your dog into the vet as soon as possible. Because like I was saying, treatment is really successful as long as it occurs soon enough, because death can result in 10 to 14 days. So as soon as you see these symptoms arise, you need to take your dog in. As well as, of course, if we find out that the dog has ingested some sort of raw fish, that's a really big sign that this dog might be, might have salmon poisoning disease. But how we really tell is through a fecal analysis, which looks for the eggs in the feces, or a sample can be taken from a swollen lymph node. And then treatment for this is sulfonamides as well as antibiotics, and then a dewormer along with either one of these will help to kill the parasite. So hospitalization and IV fluids may be required. It kind of just depends on how long the animal has been infected. As well as, like I said previously, many dogs do respond to treatment incredibly quickly, and they show improvements with just in a few days. But something really interesting is that after the dog does recover, they typically have a permanent immunity. But the book didn't really talk about this, but the dog will only have a permanent immunity to that specific strain. So a dog can actually become reinfected. So it is incredibly important to, try to employ as many preventative measures as possible. So some epidemiology. Salmon poisoning disease, or Nanophytus salmonella, is found in raw fish from the Pacific Northwest, from San Francisco to the Alaskan coast. It is most prevalent from northern California to Puget Sound. And salmon poisoning disease is also seen sometimes inland along the rivers where the fish migrate. So this makes a lot of sense, but the disease coincides with the snail distribution. Because that is the first intermediate host, the parasite needs this host to develop before it can actually cause any problems. And infected salmonoid, the ranges are high within the snail distribution area. So a specific case study it was a dog that was infected with Nanophytus salmonella, but it specifically ate a trout from a dried residential stream. So the symptoms it presented with was lethargy, a high fever, vomiting, and diarrhea. So he specifically diagnosed this bacteria using a fecal smear, which turned up positive for this parasite. And so some prevention strategies that he suggested was to keep your dog away from the water, especially if you were to go fishing, and just to, keep an eye on them and make sure that they don't ingest the raw fish. But some other prevention is that it's not really advised, but some people will actually purposefully infect their dogs as a means of control for this parasite. So if they specifically infect their dogs, obviously they know that the dog is going to show up with the symptoms and signs of salmon poisoning disease. And then they would just bring their animal to be treated by a veterinarian, and then just kind of go through that whole process, because like we have said before, that treatment is very successful. If administered early on, the dog, will survive and will develop an immunity to that specific strain. So the most interesting parasite that he has seen is Balantidium coli. Balantidium coli is an intestinal protozoan parasite that causes balantidiasis. This infection, though, is incredibly uncommon in the U.S., and its primarily definitive hosts are humans and other animals, but it actually mostly infects pigs. In pigs, though, it's not really very severe. It can be at times, but not typically. It's mostly severe in humans. So the symptoms that he found were inflammation of the small intestines, as well as the pig presented with diarrhea. And so he specifically diagnosed this in the pig by visualizing the parasite in the feces, and he thought this was incredibly interesting, mostly because he's not really very familiar with pig medicine, as well as he doesn't really treat pigs very often or conduct fecal smears on pigs. And then, as previously stated, it's incredibly uncommon in the US, so it was really interesting that he did see this parasite here. So these are the sources that I used, and thank you so much for listening. I hope you learned something new.